Most people assume the food on their plates is completely safe to eat, especially when it comes from what seems like a healthy source. Fresh greens from a hillside, wild mushrooms from a forest floor, or sushi from a trusted restaurant all carry an aura of wholesomeness. What many don't realize is that these foods, along with various types of meat and seafood, can harbor microscopic threats that pose serious health risks. Parasites remain one of the most underestimated dangers in our food supply, lurking in places we'd never expect and capable of causing illnesses ranging from mild discomfort to life-threatening conditions. The appeal of foraging wild mushrooms has grown tremendously in recent years. There's something deeply satisfying about gathering food directly from nature. And wild mushrooms offer unique flavors and textures that cultivated varieties can't match. However, beyond the well-known risk of picking poisonous species, there's another concern that receives far less attention. Wild mushrooms grow in environments where they come into contact with soil, animal feces, and water sources that may be contaminated with parasites. Certain parasitic organisms, particularly their eggs or cysts, can survive on mushroom surfaces and within the gills underneath the caps. Toxoplasma gondii is one such parasite that can contaminate wild mushrooms. This single-celled organism is commonly associated with cat feces, but it's found throughout soil in many environments where wild animals roam. When mushrooms grow in contaminated soil or are splashed with contaminated water, the parasitic cysts can adhere to their surfaces. Similarly, various species of roundworm eggs and protozoan cysts may be present on wild mushrooms. The problem becomes particularly acute because many mushroom enthusiasts prefer to minimize washing, believing it affects texture and flavor. This practice, while understandable from a culinary perspective, can leave parasites intact. The structure of mushrooms makes them especially tricky to clean properly. Their porous nature means parasites and their eggs can nestle into crevices and the delicate gills that run beneath the cap. A quick rinse under water won't necessarily dislodge these microscopic threats. Proper preparation requires careful brushing with a soft brush to remove visible dirt, followed by a thorough wash in multiple changes of water. Some experts recommend a brief soak in salted water, which can help draw out any remaining contaminants. After cleaning, cooking becomes essential. Heat is one of the most reliable ways to kill parasites, and wild mushrooms should always be cooked thoroughly rather than consumed raw or lightly sautéed. Wild greens present a similar set of challenges. Foraging for dandelion leaves, wild sorrel, watercress, and other edible plants has become increasingly popular as people seek to reconnect with traditional food sources and access nutrient-dense foods. These plants often grow in areas frequented by wildlife, near streams or ponds, or in fields where livestock graze. Each of these environments can expose the plants to parasitic contamination. Watercress deserves particular attention because of where it grows. This peppery green thrives in slow-moving streams and shallow water, making it susceptible to contamination from a parasite called Fasciola hepatica, commonly known as the liver fluke. This flatworm has a complex life cycle involving snails as intermediate hosts, and its larvae can attach themselves to aquatic plants. When humans consume raw or inadequately washed watercress, they can ingest these larvae, which then migrate to the liver and bile ducts, causing a condition called fascioliasis. Symptoms can include fever, abdominal pain, and in severe cases, significant liver damage. Other wild greens, even those growing on dry land, can harbor parasites from a different source. Animals ranging from deer to rabbits to birds may defecate near or on these plants. Their feces can contain numerous parasitic organisms, including Giardia, Cryptosporidium, and various types of worm eggs. Rain and irrigation can spread these contaminants across leaf surfaces. What makes this particularly concerning is that many of these parasites are remarkably resilient. They can survive for extended periods in the environment, withstanding temperature fluctuations and moisture changes. The microscopic size of parasitic cysts and eggs makes them virtually invisible to the naked eye. A leaf of wild lettuce or a sprig of chickweed may look perfectly clean while harboring dozens of infectious organisms. Standard washing practices that work for store-bought produce may not suffice for foraged greens. The recommended approach involves multiple steps. First, remove any obviously dirty or damaged portions, then immerse the greens in cold water and agitate them vigorously. Or drain and repeat this process at least 3 times with fresh water each time. Some food safety experts suggest adding a small amount of white vinegar to one of the washes, as the acidity can help dislodge some parasites. After washing, greens should ideally be cooked, as heat provides an additional safeguard against any remaining parasites. Raw and undercooked beef represents another significant source of parasitic infection. While many people associate pork with trichinosis, beef carries its own set of parasitic risks that are often overlooked. Taenia saginata, the beef tapeworm, is one of the most common parasites transmitted through beef consumption. This tapeworm can grow to extraordinary lengths inside the human intestine, sometimes reaching over 30 feet. Infection occurs when people eat beef containing the larval stage of the parasite, known as cysticursi, which appear as small, fluid-filled cysts in the muscle tissue. The larvae are killed by proper cooking, but rare or medium-rare beef may not reach sufficient internal temperatures throughout. Tartare, carpaccio, and other raw beef preparations carry the highest risk. Once consumed, the larvae develop into adult tapeworms in the human intestine, where they can survive for years if left untreated. While tapeworm infections are often asymptomatic or cause only mild digestive disturbances, they can lead to weight loss, nutritional deficiencies, and in rare cases, intestinal blockages. The psychological distress of discovering you're hosting a parasite several feet long shouldn't be underestimated either. Another concern with beef is Toxoplasma gondii, the same parasite that can contaminate mushrooms and is often associated with cats. Cattle can become infected by ingesting contaminated feed or water, and the parasites form tissue cysts in their muscles. These cysts survive in meat that isn't cooked to adequate temperatures. Toxoplasmosis can be particularly dangerous for pregnant women, as the parasite can cross the placental barrier and cause serious complications for the developing fetus, including neurological damage and vision problems. Sarcocystis species represent yet another group of parasites found in beef. These protozoan parasites form cysts in muscle tissue, and while many Sarcocystis infections in humans are mild, some species can cause severe gastrointestinal symptoms, including nausea, vomiting, and diarrhea. And the cysts are typically destroyed by cooking, but raw or undercooked beef can transmit the infection. The solution for beef-related parasitic risks is straightforward in principle, but requires careful attention in practice. Cooking beef to an internal temperature of at least 145 degrees Fahrenheit, followed by a 3-minute rest time, will kill most parasites. Ground beef should reach 160 degrees Fahrenheit throughout, as the grinding process can spread any surface contamination throughout the meat. For those who prefer rare beef, freezing offers an alternative safeguard. Freezing beef at -4 degrees Fahrenheit for at least 7 days will kill most parasitic larvae. However, this requires a reliable freezer that can maintain consistent low temperatures, not just the typical home freezer set to 0 degrees. Fish and seafood present perhaps the most complex array of parasitic risks among commonly consumed foods. The diversity of species, preparation methods, and geographic sources means the parasitic threats vary widely. Raw fish consumption has become mainstream in many Western countries, with sushi and sashimi restaurants proliferating and home cooks experimenting with poke bowls and ceviche. This trend has brought increased attention to the parasites that can inhabit fish flesh. Anisakis simplex is probably the most notorious fish parasite. These roundworms are found in many species of marine fish, including salmon, mackerel, herring, and cod. The larvae embed themselves in the fish's muscles or organs, appearing as small, coiled white worms. When humans consume infected raw or undercooked fish, the larvae attempt to burrow into the stomach or intestinal walls, causing anisakiasis. This condition can produce severe abdominal pain, nausea, and vomiting within hours of consumption. In some cases, the larvae cause allergic reactions that can be life-threatening. The prevalence of anisakis in wild-caught fish is surprisingly high. Studies have found infection rates exceeding 90% in some fish populations. Farmed fish generally have lower rates because their controlled diet reduces exposure to intermediate hosts, but they're not entirely risk-free. The visual inspection that occurs during fish processing catches many worms, but small larvae can be missed, especially when they're deeply embedded in the tissue. Diphyllobothrium latum, the fish tapeworm, represents another significant concern. So this parasite is found primarily in freshwater fish from cold regions, including salmon, pike, perch, and trout. The tapeworm larvae form cysts in fish muscle, and when humans eat infected fish without proper preparation, the larvae develop into adult tapeworms in the intestine. These tapeworms can grow even longer than beef tapeworms, sometimes exceeding 30 feet. They compete with their human host for nutrients, particularly vitamin B12, potentially leading to severe anemia in long-term infections. Various species of flukes also infect fish. Clonorchis sinensis and Opisthorchis vivarini are liver flukes transmitted through freshwater fish consumption, particularly in parts of Asia where raw or undercooked fish dishes are traditional. These flatworms migrate to the bile ducts and liver, where they can persist for decades. See, chronic infections increase the risk of cholangiocarcinoma, a type of bile duct cancer. While these specific flukes are less common in fish from other regions, related species exist worldwide. The preparation of raw fish dishes requires strict adherence to food safety protocols. Commercial sushi-grade fish has typically been frozen at extremely low temperatures, specifically to kill parasites. FDA guidelines recommend freezing fish at -4 degrees Fahrenheit for 7 days, or at -31 degrees Fahrenheit for 15 hours. These temperatures and durations are sufficient to kill parasitic larvae. Home freezers often don't reach these temperatures reliably, which is why purchasing fish that's been commercially frozen is safer than freezing fresh fish at home for raw consumption. Cooking provides a more reliable safeguard. Fish should be cooked to an internal temperature of 145 degrees Fahrenheit, at which point the flesh becomes opaque and separates easily into flakes. This temperature ensures that any parasites present are killed. For those who enjoy dishes like ceviche, where fish is cooked in citrus juice, it's important to understand that acid doesn't kill parasites reliably. The acid denatures proteins and changes the fish's texture and appearance, giving the impression of cooking. But parasitic larvae can survive this process. Using previously frozen fish is essential for ceviche and similar preparations. Shellfish, including shrimp and crab, present their own parasitic concerns. While these animals are typically cooked before consumption in Western cuisines, certain preparations involve raw or lightly cooked shellfish. Additionally, improper handling and cross-contamination in kitchens can spread parasites from raw shellfish to other foods. Paragonymous species are lung flukes that can be transmitted through raw or undercooked freshwater crabs and crayfish. These parasites are particularly common in Asia, but have been found in North America as well. When humans consume infected shellfish, the larvae penetrate the intestinal wall, migrate through the abdominal cavity, and eventually reach the lungs. There they form cysts and mature into adult flukes. Paragonymiosis causes chronic cough, chest pain, and difficulty breathing. In some cases, the larvae take wrong turns during their migration and end up in the brain or other organs, causing serious neurological complications. Shrimp can harbor various parasitic organisms, though many are harmless to humans. But however, some protozoan parasites found in shrimp can cause gastrointestinal illness. More concerning is the potential for cross-contamination. Raw shrimp brought into a kitchen can introduce parasites and their eggs onto cutting boards, utensils, and other surfaces. If these contaminated surfaces then come into contact with foods that won't be cooked, such as salad ingredients, parasites can be transferred. The answer for shellfish safety is thorough cooking. Shrimp should be cooked until they turn pink and opaque throughout. Crab should be cooked until the shell turns bright red and the meat is firm and white. Internal temperatures should reach at least 145 degrees Fahrenheit. For dishes that traditionally use raw shellfish, such as certain Asian preparations, using shellfish that has been previously frozen offers some protection, though freezing is less reliable for killing all shellfish parasites compared to fish parasites. Aquatic plants consumed by humans carry risks similar to watercress, but deserve separate discussion because of their increasing popularity. Water spinach, lotus root, water chestnuts, and various types of seaweed are used in cuisines around the world. These plants grow in aquatic environments where they can come into contact with numerous parasitic organisms. Fasciolopsis busci is a large intestinal fluke that commonly infects aquatic plants in Asia. The parasite's life cycle involves snails as intermediate hosts and the larvae encyst on aquatic vegetation. When people peel water chestnuts with their teeth or eat raw water spinach, they can ingest these cysts. In the intestine, the flukes attach to the intestinal wall and can cause severe abdominal pain, diarrhea, and intestinal obstruction. Heavy infections can be life-threatening, particularly in children. The consumption of raw or undercooked crab presents another significant parasitic threat that often gets overlooked in discussions about food safety. Paragonimus westermanni, commonly known as the lung fluke, has a particular affinity for crustaceans. This parasite's life cycle is complex, involving both aquatic snails and crustaceans before finding its way into human hosts. When someone consumes raw or improperly cooked crab or crayfish, the larval stage of this fluke can penetrate the intestinal wall and migrate through the body, often settling in the lungs where it causes a condition called paragonimiasis. The symptoms of lung fluke infection can be mistaken for tuberculosis or other respiratory diseases. Patients experience chronic cough, chest pain, and may cough up blood-tinged sputum. The infection can persist for years if left untreated, and in some cases the flukes migrate to other organs including the brain, where they can cause serious neurological complications. Traditional dishes that involve raw or lightly pickled crab, particularly popular in parts of Asia, are common sources of infection. Even the practice of using raw crab juice in certain regional cuisines can transmit the parasite. The treatment for paragonimiasis typically involves antiparasitic medications, but the damage caused by the flukes as they migrate through tissue can be permanent. Prevention is straightforward but requires discipline. Which crabs and crayfish must be cooked thoroughly, with the internal temperature reaching at least 145 degrees Fahrenheit for several minutes. The practice of consuming drunken crab, where live crabs are soaked in alcohol, does not kill the parasites. Similarly, pickling or marinating raw crab in vinegar or other acidic solutions fails to eliminate the lung fluke larvae. Shrimp, despite their popularity and apparent simplicity, can also harbor parasites that pose health risks. While less common than other parasitic infections, gnathostomiasis results from consuming raw or undercooked freshwater shrimp infected with gnathostoma larvae. This parasite has an unusual behavior pattern once inside the human body. Rather than settling in one location, it migrates continuously through tissues, creating serpentine tunnels under the skin or through internal organs. The most visible manifestation of gnathostomiasis is cutaneous larva migrans, where raised, red, winding tracts appear on the skin as the larva burrows along. These tracts are intensely itchy and can appear anywhere on the body. However, the more serious concern arises when the larvae migrate to internal organs. Cases have been documented where gnathostoma larvae reach the brain, causing eosinophilic meningitis with severe neurological symptoms including paralysis, altered consciousness, and even death. The eyes are another vulnerable target, with the parasite potentially causing blindness if it reaches ocular tissues. Treatment for gnathostomiasis can be challenging because the parasite's constant movement makes it difficult to target with medication. Surgical removal is sometimes necessary when the parasite can be located, particularly if it threatens vital structures. The most effective prevention involves thoroughly cooking all shrimp and avoiding dishes that feature raw or barely cooked preparations. This includes certain ceviche preparations if the shrimp hasn't been previously frozen to kill potential parasites. The relationship between parasites and their food hosts extends beyond individual species to entire categories of cuisine. Raw fish preparations, while culturally significant and increasingly popular worldwide, represent a particularly diverse source of parasitic infections. Beyond the previously mentioned anisakid worms, other parasites lurk in inadequately prepared fish. Diphyllobothriasis, caused by the fish tapeworm Diphyllobothrium latum, results from eating raw or undercooked freshwater fish. This tapeworm can grow to extraordinary lengths inside the human intestine, sometimes exceeding 10 meters. Most infections cause mild symptoms or remain asymptomatic, but the parasite competes with its host for vitamin B12, potentially leading to severe deficiency. This deficiency can manifest as pernicious anemia, with symptoms including fatigue, weakness, pale skin, and neurological problems such as numbness, tingling, and difficulty walking. The tapeworm's presence becomes evident when infected individuals pass segments of the worm in their stool, a disturbing but definitive diagnostic sign. The global nature of fish trade complicates parasite prevention. Fish caught in one region may be processed in another and consumed thousands of miles away. And this distribution network means that parasites traditionally associated with specific geographic areas can appear unexpectedly in distant locations. The popularity of sushi and sashimi has spread worldwide, but education about proper fish handling hasn't always kept pace. Many home cooks and small restaurant operators lack knowledge about the critical importance of freezing fish intended for raw consumption. Professional sushi chefs undergo extensive training that includes learning to identify potential parasitic contamination in fish. They know which species carry higher risks and which parts of the fish are most likely to harbor parasites. The skill of a trained sushi chef includes not just cutting technique, but also visual inspection for parasites, knowledge of seasonal variation in parasite prevalence, and understanding proper storage temperatures and times. This expertise cannot be replicated by simply following a recipe or watching online tutorials. Wild game presents yet another category of parasitic concern that often flies under the radar of food safety discussions. Bear meat, in particular, is notorious for harboring Trichinella spiralis, the roundworm that causes trichinosis. Unlike many other parasites that remain in the digestive tract, Trichinella larvae migrate to muscle tissue throughout the body, forming cysts that can persist for years. When someone consumes infected bear meat that hasn't been cooked to a high enough temperature, the larvae are released in the stomach and quickly invade the intestinal wall. The initial phase of trichinosis resembles food poisoning, with nausea, diarrhea, and abdominal pain appearing within days of eating infected meat. However, the more serious symptoms emerge as larvae migrate to muscle tissue. Patients develop severe muscle pain, particularly in muscles used for breathing and chewing. Swelling around the eyes is characteristic, along with fever, weakness, and in severe cases, heart and neurological complications. The infection can be fatal if a large number of larvae are consumed. Bear meat requires special handling because traditional cooking methods may not reach the internal temperatures necessary to kill Trichinella. The parasite cysts can survive temperatures that would cook the meat to what seems done by appearance and texture. Only by using a meat thermometer and ensuring every part of the meat reaches at least 160 degrees Fahrenheit can cooks guarantee safety. Smoking, drying, or curing bear meat without reaching these temperatures does not eliminate the risk. The parasite's resilience means that even meat that looks, smells, and tastes properly cooked may still harbor viable larvae. Wild boar carries similar risks, and the increasing popularity of wild game in upscale restaurants has brought trichinosis back into focus as a public health concern. Hunters who share their harvest with friends and family may inadvertently spread infection if they don't understand proper cooking requirements. The romantic notion of field dressing game and preparing it with traditional methods can clash dangerously with parasitic reality. Venison and other wild ruminants can carry their own parasitic burdens. While trichinosis is less common in deer than in bears or wild pigs, high deer can harbor other parasites including Toxoplasma gondii. This single-celled parasite has a remarkably complex relationship with its hosts and poses special dangers to pregnant women and immunocompromised individuals. While cats are the definitive host where the parasite reproduces sexually, many other mammals, including deer, serve as intermediate hosts. When someone consumes undercooked venison infected with Toxoplasma cysts, the parasites are released and can spread throughout the body. In healthy adults, the infection often causes only mild flu-like symptoms or remains completely asymptomatic. However, the parasite forms cysts in tissues, particularly the brain and muscles, where it can persist for life in a dormant state. For pregnant women, the stakes are much higher. If a woman acquires toxoplasmosis during pregnancy, and the parasite can cross the placenta and infect the developing fetus, potentially causing severe birth defects, miscarriage, or stillbirth. The reactivation of dormant toxoplasma in people with weakened immune systems can cause severe disease, including encephalitis. This has been a particular concern for people living with HIV/AIDS before effective antiretroviral therapy became available, but it remains a risk for transplant recipients and others on immunosuppressive medications. The widespread nature of toxoplasma infection in wild animal populations means that hunters and their families need to be especially careful about cooking wild game thoroughly and practicing good hygiene when handling raw meat. Beyond meat, seafood, and aquatic plants, If certain vegetables grown in soil fertilized with untreated human waste can harbor parasites, this practice, more common in some developing regions, creates a direct route for parasitic transmission. Ascaris lumbricoides, the giant roundworm, produces eggs that pass in human feces. When these eggs contaminate soil and vegetables aren't properly washed or cooked, the eggs can be ingested by new hosts. Ascaris infections can involve worms that grow up to 35 centimeters long inside the human intestine. While light infections may cause few symptoms, heavy worm burdens can lead to intestinal obstruction, malnutrition, and impaired growth in children. The larvae migrate through the body after hatching, passing through the liver and lungs before returning to the intestine to mature. This migration can cause respiratory symptoms. And in rare cases, the worms may cause serious complications by migrating into bile ducts or the appendix. The prevention of ascariasis through food requires attention to agricultural practices and food preparation. Raw vegetables that may have been grown in contaminated soil should be washed thoroughly with clean water and, when possible, peeled or cooked. However, washing alone may not remove all eggs, as they're sticky and can adhere firmly to vegetable surfaces. In areas where the use of human waste as fertilizer is common, cooking vegetables thoroughly provides the most reliable protection. Leafy greens present particular challenges because their complex surfaces provide many hiding places for parasites and their eggs. Lettuce, spinach, and similar vegetables eaten raw in salads require especially careful washing. And some experts recommend soaking them in water with a small amount of vinegar or a vegetable wash solution, though these measures are not completely effective against all parasitic forms. The reality is that raw vegetables carry inherent risks that can be minimized but never entirely eliminated without cooking. The intersection of traditional food practices and modern food safety knowledge creates tension in many cultures. Foods that have been prepared and consumed for generations using traditional methods may not meet current safety standards, yet they hold cultural significance that transcends health concerns. The challenge lies in finding ways to preserve cultural food traditions while adapting preparation methods to reduce parasitic risks. Take raw beef dishes like kitpho, a traditional Ethiopian preparation, or yuko, the Korean version of beef tartare. These dishes are deeply embedded in their respective culinary traditions, yet they carry inherent risks of parasitic and bacterial contamination. Some adaptations are possible, such as using only high-quality beef from reputable sources, freezing the meat before preparation to kill potential parasites, and ensuring impeccable handling practices. However, these modifications require resources and knowledge that may not be available to everyone. The economics of food safety cannot be ignored. Higher quality ingredients from suppliers with better safety practices cost more money. Proper cooking equipment, refrigeration, and freezers that can reach temperatures low enough to kill parasites require investment. For many families, especially in developing regions, when these resources are simply out of reach. This creates a situation where parasitic infections disproportionately affect poorer populations who have less access to safe food and clean water. Even in wealthy nations, pockets of higher parasitic infection rates often correlate with poverty and lack of education. Immigrant communities may continue traditional food preparation practices without awareness of parasitic risks in their new environment, or they may lack the language skills to understand public health messaging about food safety. Public health interventions need to be culturally sensitive and linguistically appropriate to be effective. Education about parasites in food faces several obstacles. The topic makes many people uncomfortable, and there's a tendency to believe that parasitic infections are problems of the past or concerns only in faraway places. This misconception allows risky food practices to continue unchallenged. Additionally, the symptoms of many parasitic infections are vague and easily attributed to other causes, meaning people may be infected without realizing it. The rise of food tourism and adventurous eating has introduced new risks. Travel shows and social media influencers often showcase exotic foods, including raw or undercooked preparations, without adequately addressing safety concerns. Viewers may attempt to recreate these experiences at home without understanding the risks or proper preparation techniques. The desire to be adventurous with food is admirable, but it should be tempered with knowledge about how to do so safely. Home gardening and foraging have surged in popularity, particularly in urban areas. While growing your own food or gathering wild edibles can be rewarding, these practices come with their own parasitic risks. Gardens fertilized with compost may contain parasitic eggs if the composting process didn't reach high enough temperatures to kill them. Some composting methods, particularly cold composting or vermicomposting, never reach temperatures sufficient to destroy parasitic eggs. Wild foraged greens like dandelion, purslane, and lamb's quarters can be contaminated with parasites from animal feces. Wildlife moving through areas where edible plants grow may leave behind parasitic eggs that contaminate the vegetation. Thorough washing helps, but isn't foolproof, and cooking foraged greens provides better protection. The romanticism of eating wild foods should be balanced with realistic assessment of risks. Farmers' markets and farm-to-table movements emphasize freshness and minimal processing, which generally benefits food quality. However, these direct-from-farm foods may have received less intensive safety treatment than conventional supermarket produce. Small farms may not have the same testing and monitoring systems as larger operations. This doesn't mean farmers' market food is inherently dangerous, but consumers need to ask questions about growing practices and take appropriate precautions in washing and cooking. Water used to wash vegetables deserves attention in any discussion of food-borne parasites. If the water itself is contaminated with parasitic cysts or eggs, washing vegetables with it can actually increase contamination rather than reduce it. This is particularly concerning in areas without reliable clean water access. Using bottled or properly filtered water for washing produce destined to be eaten raw makes sense in places where water quality is questionable. The seafood industry has made strides in parasite control through better fishing practices, improved handling, and mandatory inspections. However, climate change is altering marine ecosystems in ways that may affect parasite prevalence. Warming ocean temperatures allow some parasites to expand their geographic ranges, potentially introducing them to areas where they were previously unknown. Changes in fish migration patterns and breeding grounds can also affect parasitic transmission cycles. Aquaculture, or fish farming, offers some advantages for parasite control, since farmed fish can be raised in controlled environments with careful monitoring. Feed for farmed fish can be treated to eliminate parasites, and the fish themselves can be inspected more easily than wild-caught specimens. However, fish farming brings its own concerns, including the potential for parasites to spread rapidly through densely packed populations, and the possibility of farmed fish infecting wild populations if they escape. The question of how to balance enjoyment of diverse foods with safety concerns doesn't have a simple answer. Completely avoiding all foods that could potentially harbor parasites would eliminate many nutritious and culturally important foods from the diet. The more practical approach involves understanding risks, taking appropriate precautions, and making informed choices about which risks are acceptable and which aren't. For individuals with compromised immune systems, pregnant women, young children, and elderly people, the calculation changes. These vulnerable populations need to be more cautious about foods that carry parasitic risks. What might cause only mild discomfort in a healthy adult could have serious consequences for someone whose immune system can't mount an effective response. Healthcare providers should discuss food safety explicitly with these at-risk patients, but often these conversations don't happen. The medical community has a role to play in improving awareness about food-borne parasites. Physicians should include questions about dietary habits when taking patient histories, particularly when symptoms suggest possible parasitic infection. Too often, doctors in developed nations don't consider parasites in their differential diagnosis because they assume these infections are rare in their patient populations. This can lead to misdiagnosis and delayed treatment. Laboratory testing for parasitic infections has improved significantly, but it still requires clinical suspicion to order the appropriate tests. Stool samples need to be collected properly and examined by trained technicians who know what to look for. Some parasites are shed intermittently, requiring multiple samples over several days to detect. Blood tests can identify antibodies to certain parasites, but these tests aren't always readily available or covered by insurance. Treatment options for parasitic infections have expanded, with several effective anti-parasitic medications now available. However, some parasites remain difficult to treat, particularly once they've formed cysts in tissues or migrated to inaccessible locations. Prevention through proper food handling and preparation remains far preferable to treatment after infection has occurred. Food safety regulations exist to protect public health, but they vary widely between countries and aren't always enforced effectively. International trade in food products means that items produced under one country's safety standards may be sold in another country with different expectations. This patchwork of regulations creates gaps where parasitic contamination can slip through. Restaurants face particular challenges in ensuring food safety while meeting customer expectations for specific preparations. When a customer orders steak cooked rare or requests sushi, the restaurant must balance food safety guidance with customer preference. Some establishments have adopted policies of serving certain high-risk foods only with explicit acknowledgement from customers that they understand the risks. So the trend toward transparency in food sourcing has benefits for parasite prevention. When restaurants and retailers provide detailed information about where food comes from and how it was handled, consumers can make better informed decisions. Traceability systems that track food from source to table help identify and address contamination when it occurs. Technology offers new tools for parasite detection and prevention. Improved microscopy techniques, DNA-based testing methods, and artificial intelligence systems that can analyze images of food products for signs of parasites are all in development or early deployment. These technologies may eventually make it possible to screen food more efficiently and catch contamination before it reaches consumers. However, technology alone cannot solve the problem of food-borne parasites. Human behavior, cultural practices, and economic factors all play crucial roles. The most sophisticated detection system does no good if people continue to consume raw or undercooked high-risk foods without taking basic precautions. Education and behavior change remain essential components of any comprehensive approach to reducing parasitic infections from food. The conversation about parasites in food needs to happen more openly and regularly, rather than treating it as a disturbing topic to be avoided. We should normalize discussions about food safety in the same way we talk about other health concerns. Parents should teach children about proper cooking and hygiene. Schools should include food safety in their curricula, and public health campaigns should address the topic directly. Individual actions matter significantly in preventing parasitic infections from food. Simple steps like using a food thermometer to ensure meats reach safe internal temperatures, freezing fish intended for raw consumption, thoroughly washing vegetables, and practicing good hand hygiene when handling food can dramatically reduce risk. These aren't complicated or expensive interventions, but they require consistent application. The relationship between humans and the parasites that share our food has existed throughout our history. Ancient medical texts describe symptoms that clearly indicate parasitic infections, and archaeological evidence shows that our ancestors dealt with food-borne parasites. Modern understanding and technology give us advantages they didn't have. But we still share the basic challenge of ensuring that what we eat nourishes rather than harms us. Looking forward, the challenge of managing parasites in our food supply will likely become more complex rather than simpler. Global climate change, increasing international food trade, changing dietary preferences, and evolving parasites all contribute to a dynamic situation that requires ongoing attention and adaptation. What works today may need to be modified tomorrow as circumstances change. The key takeaway is that awareness and appropriate action can allow us to enjoy a wide variety of foods while minimizing parasitic risks. This doesn't require paranoia or excessive restriction. But it does demand respect for the reality that many foods can harbor parasites, and that proper handling makes the difference between a delicious meal and a dangerous one. By understanding the risks associated with specific foods and preparation methods, and by taking sensible precautions, we can protect ourselves and our families while still enjoying the diverse bounty that food offers.